My name is Hilda. I'm from Morobe province and I'm a dentist. So I was doing science at uni and then I had this really horrible toothache. I felt like my head was going to explode. I had no idea what was happening to me. I just stayed on with a toothache until end of the year. There was a roadshow. They were talking about this new program that was at the medical faculty, the BDS program. So I went, found out more, and I thought, this is going to be interesting. So the dental school was closed for 20 years, and that year that I applied was the time that they reopened the dental school. So me and my 15 classmates were the first dentists to be trained in PNG in 20 years. So when I first graduated in 2009, we were sent out into the provinces to do internships. And it was the most challenging years of my dental profession because after 20 years, there's no facility and no materials out there to work with. So after my 2 years internship at the hospitals, I went on the Pacific Link, and that was my first time with the YWAM medical ships. My time on the Pacific Link was sort of helped me get a good hands-on practice with all these new materials that are being used out there. So after the Pacific Link, I went back to the public system, worked there for 2 years. And while I was working, I was given this wonderful opportunity through the Australia Awards Scholarship Program. So I took it up and went to Australia to study public health degree in James Cook Uni in Townsville. After the training in Townsville, I came back last year and I've been doing a couple of outreaches on the medical ship, because I feel like YWAM gives me the opportunity to go out there and practice both dentistry and public health. So I'm reaching out to the people out there in the villages, provide them dental services, and at the same time we're educating them and seeing how the disease patterns improving from one to the other. So it's really good and I'm enjoying every moment of it. The first time I went to Karate Village was back in 2011 on the Pacific Link. Most of the 2 weeks, we've seen patients with all the retained roots broken down, large cavities. They had really bad oral hygiene. They've never been to a dentist before. After that, the ship kept going to that same village every year. And then last year, I had the opportunity to go back to that same village, and the oral hygiene of the people had really improved, and the teenagers had perfectly good teeth, no more retained roots. So all we did was just cleaning and oral hygiene, some restorations, a very inspiring moment for me. So from that moment, I realized the importance of education, because before that, I didn't really believe in it. But after that, I started educating my patients on the chair after treating them. And over the last couple of outreaches I've been on the ship, I've learned a lot of things clinically, as well as working with the team, people from different backgrounds coming together and just making things happen. Anything is possible, you know, there's no such thing as impossible. We can make it work if we really want to. And also I've been empowered and inspired to see like all these dental professionals coming here to serve my people out in the remote villages. It's very encouraging for me that we can't do this alone, but together we can do it.